of the most important events in the field of public health in our country was held in Moscow in October 24th, 25th of 17, the Second Congress of Cancer Patient. A unique congress, it brought together the representative of 57 regions of Russia, patient and their family members, patient advocacies, and leading oncologists from all over the country and abroad, as well as legislators met together in Moscow to determine the future national cancer program. This important meeting was jointly organized by Russian Society of Clinical Oncology, the Commission of Russian Federation for Healthcare and Healthcare Department for Eurasian Federation of Oncology, and Interregional Public Organization Association of Oncological Patients Zdravstvuy. Over these 2 days, major figures in Russia and international oncologists, patients, scientists, and representatives of the legislative discussed the development of cancer care in our country in the coming year. Doctors shared their recommendation on rehabilitation. Patients talked about their hope and provided a view of the problems from the inside. The authorities talked about ways of solving financial difficulties, and the legislators discussed how to combine the interests of all the participants of the process to achieve the main goal, human health. As the Second Russian Congress, patients from all over the country heard about the latest technologies talked about in their problems. All these are truly very important, said Irina Borovova, the president of Zdravstvuy. We are all together, patients, doctors, legislators have managed to listen to each other and have formulated proposals and purpose for solving urgent problems that will form the basis of the national cancer program. Representatives of the authorities and doctors met these who are the most interested in creating and balanced oncological programs, the Patient Zdravstvuy Association. Together with the partners, did symptomatical work month after month on the creation of local patient communications in different regions of the country. The communities are ready to make themselves known, to appeal the authorities, to doctors, to residents in order to talk what had been formerly considered taboo cancer. Every year, almost 280,000 people in Russia die from malignant tumors. Effective methods of detection and treatment are still unavailable for many patients. Just think about these figures. According to the chairman of the Russian Society of Clinical Oncology, Sergei Tulyandin, over the past 10 years, the number of patients with cancer has increased by 20%. Consequently, every fourth citizen in the country risks developing cancer, and every sixth citizen will die from this disease. That's why information about cancer must be treated with this seriousness. One of the most important topics in the expert discussion was the need for additional training of primary care physicians. An increase in their knowledge and capability will aid in timely detection of oncological symptoms and deterioration in the patient conditions. Vice Speaker of the State Duma of Russian Federation, Petr Tolstoy, noted the great importance for the Congress and the work on patient communities in the local regions. Together, it is possible to reach a consequence. Several legislative initiatives are already being worked out, some of which, for example, will help to improve the provision of necessary medication to cancer patients. Thanks to the patient initiative, a press conference was held in the Congress. It brought together not only representatives of the media, but also civil activities, public figures, doctors, and patients. The moderator of the meeting was a well-known writer and a former cancer patient, Daria Dontsova. The participants of the Second Congress of Cancer Patient combined all their recommendations in a resolution and forward to the government of the Russian Federation. Some of their recommendations are a strong need to increase the awareness of the population about the importance of preventive examination, high-risk groups, and measures for the prevention of cancer. Create a system personalized registration of cancer patients for monitoring the quality of medical care from the time of diagnosis through the treatment period and subsequent rehabilitation. Restrict the participation in the public procurement of medical products of manufacturers who do not have good manufacturing price certification, GMP. One of the most important aims was the proposal to modify the existing state register of clinical studies in order to simplify the search for information for both patient and doctors. Discussing physical issues, the participant and medicals on the meeting are also focused on development of the oncological assistance Здравствуй. Association conducts monthly report groups where oncologists worked along oncologists. Together, they are responding to the most difficult questions of the patients. Guests from a dozen of countries, including India, Greece, United States, and Turkey, shared extremely interesting experience. On the other hand, the experience of foreign colleagues provide an alternative view of reality. On the other, they give the impetus to develop the cooperative in the interregional and interslative level in saving millions of lives. The resolution of the Second Russia Congress of Cancer Patients included ideas and suggestions for improving and optimizing the system of providing oncological cares for the population. The resolution will be reflected in the National Cancer Program and will help patient communities reach a new level of communication with the authorities. The document is the result of many years of work, therapy, and research, which is the author, patient, doctors, and the government have written. It's hoped that this resolution will change the lives of many Russian people.